Hello everyone, welcome to the video presentation on drug Zanamivir. I will discuss pharmacokinetics and pharmacodynamics properties of this drug. Furthermore, my video will represent the interdisciplinary team who works coordinately to ensure safe medication practice, followed by crucial counseling considerations for patients using Zanamivir. Let's start with what is Zanamivir. Zanamivir belongs to the drug class neuraminidase inhibitor used in the treatment and prevention of infection caused by influenza A and B virus in children and adults who are 5 years or over and have had symptoms of the flu for less than 2 days. It comes as a powder for inhalation via the mouth, and the therapeutic class of Zanamivir are anti-infectives, antiviral, and neuraminidase inhibitor. Furthermore, it is sold under trade name Relenza. Now I'm going to discuss the pharmacokinetics property of this drug following ADMA. In absorption, the bioavailability of Zanamivir is very low, averaging 2% if taken orally. Following oral inhalation, dose is absorbed from the gastrointestinal tract with bioavailability up to 4 to 17%. Plasma concentration reaches to maximum level within approximately 1 to 2 hours. Moving on to distribution, drug is broadly deposited throughout the respiratory tract following oral inhalation. Plasma protein binding is less than 10% with approximately 60 liters of volume distribution. Interestingly, Zanamivir is not metabolized, hence the possibilities for drug-to-drug interaction is very low. At the last excretion, approximately 90% of drugs is excreted via urine unchanged, and rest of the non-absorbed drugs are excreted in feces. It is eliminated from the body within 24 hours of a single completed dose. Let's move on to pharmacodynamics. The structure of Zanamivir is similar to natural neuraminidase salicylic acid binding site. When the protein is activated from the influenza virus to leave the host cell, Zanamivir mimics neuraminidase salicylic acid by fitting directly to the active site. It blocks the neuraminidase protein, which inhibits the potential of the virus to move, replicate, and affect other host cells. As the result, the virus is unable to spread infection after using Zanamivir. This drug leads to different physiological effects ranging from minor effects like headache, dizziness, coughing, cold-like symptoms, nausea, vomiting, and diarrhea to severe and fatal effects like seizures, hallucinations, difficulty breathing, and trouble speaking. The drug leads to different physiological effects ranging from minor effects like headache, dizziness, coughing, cold-like symptoms, nausea, vomiting, and diarrhea, to severe and fatal effects like seizures, hallucinations, difficulty breathing, and trouble speaking. This drug leads to different physiological effects ranging from minor effects like headache, dizziness, coughing, cold-like symptoms, nausea, vomiting, and diarrhea, to severe and fatal effects like seizures, hallucinations, difficulty breathing, and trouble speaking. This drug can lead to different physiological effects ranging from minor effects like headache, dizziness, coughing, cold-like symptoms, nausea, vomiting, and diarrhea, to severe and fatal effects like seizures, hallucinations, difficulty breathing, and trouble speaking. This drug leads to different physiological effects ranging from minor effects like headache, dizziness, coughing, cold-like symptoms, nausea, vomiting, and diarrhea, to severe and fatal effects like seizures, hallucinations, difficulty breathing, and trouble speaking. Furthermore, the efficacy of Zanamivir is 67% in laboratory comparison to placebo. It additionally gave 84% efficacy when treating laboratory-confirmed influenza with fever. Moreover, Zanamivir falls under Schedule 4 of Standard for Uniform Scheduling of Medicines and Poisons (SUSMP). It is a prescription-only medicine which requires a prescription from an authorized prescriber to get access to the medication. Several key counseling should be communicated with patient using this drug. For example, ensuring the patient is lactose-free by asking them if they suffer any side effects due to lactose, as Zanamivir contains lactose. Number two, letting the patient know about the rare but possible side effects, and if they are undergoing any of the symptoms, to seek immediate medical assistance via contacting the doctor, and educate asthma patients about the precautions they will need to undergo while taking Zanamivir. As if they use their asthma puffer, then follow it by taking Zanamivir to prevent the rare but possible effect of bronchospasm, which can be fatal. Let's see if you have been paying attention.